My name's Matthew Green. I'm an orthopedic hand surgeon, and I work for Intermountain in Provo and American Fork. I work at Utah Valley Regional Medical Center and American Fork Hospital. I decided pretty early on that I wanted to do orthopedic surgery when I was in high school, and when I was applying for medical school, I had the opportunity to have surgery on my own hand, and so that got me interested in that. I did my med school and residency training in the Bronx and had a lot of interesting experience there. I was in New York for a total of 10 years, and then I went to New Mexico for a fellowship in hand surgery. The most enjoyable part of my job is when patients come back to see me after having had surgery, and they tell me that they are amazed at how much better they feel. Some of the more common surgeries that I do include things like carpal tunnel surgery and trigger finger releases, which have very predictable results, and the patients are pretty much universally happy. I really enjoy that, but I also enjoy the more difficult cases where there are challenges dealing with difficult trauma and arthritis, and sometimes it's a long haul, but once we get to the point where everything is kind of settled down, the patients are very grateful, and I really enjoy that. One of the things that I like to think about when I'm deciding on a course of treatment for my patients is actually maybe counterintuitive for a surgeon, but I do like to consider my non-surgical options as much as possible. I know that many patients are very averse to having surgery under any circumstances, and while there are certain clear-cut indications for surgery, there are certainly some gray areas. And I like my patients to know that I consider surgery for most things to be a last resort, and so we will try to avoid that if we can, and if it becomes necessary, then we know that we've tried everything else, if at all possible.